Good evening, Los Angeles, and thank you as always for joining us. I hope that you're getting through these days, and today was an exciting day in many ways. It's a nervous one, but one that we have been waiting for a long time. As we heard Dr. Barbara Ferrer, our amazing head of our county public health department, who said that beginning this Friday in just 2 days, on May 8th, certain retail businesses in the county of Los Angeles will be permitted, listed as non-essential before, are now going to be permitted for curbside pickup. And some public spaces like trails and golf courses will also open. Now that the County of Los Angeles has made this announcement, I'd like to take a moment and tell you what that means for Los Angeles and how we'll make decisions moving forward towards a safer LA. In the beginning of this crisis, we were all called on to react to something we didn't know, a threat we couldn't see, and then to respond to it quickly and swiftly by issuing our safer at home orders, being one of the first cities in the country to do everything from testing to requiring face coverings. We have led the way, and you have led the way. Thanks to you, we have bent the curve. We still have a threat that is as dangerous today as when we started, but we have hopeful moments, and we have learned every step of the way what to do and what not to do. And we're going to have that same wisdom guiding us in the days moving ahead. The honest answer to your question of what this means today is simple. Life is not going back to the way that it was before. I have said in the last couple nights, this isn't about white and black, a completely closed city or a completely open one. Even as we stayed safer at home, we had plenty of things that were open, critical and essential businesses, as well as some that could safely continue to operate. When we found moments like with farmers markets or others where we had to shut things down and improve, we did it. And we showed that all of us together could hang on to some of those things that were important to us and essential to our lives. This virus continues to threaten all of us here in Los Angeles. Each day, don't ever forget those numbers that I announce and that you hear from the county, our human lives, people that we know and have loved who are now gone because of this. We're not moving beyond COVID-19. As I keep saying, we are learning how to live with it. I know none of us want to, but we have no choice. And we're doing that by taking steps to safety. And really what was announced today are those first baby steps. We took a lot of steps backwards, sometimes even leaps. But now these baby steps forward are going to be in all of our hands to make sure they succeed. Together with the county, I will tomorrow modify our safer at home order here in the city of Los Angeles. And beginning Friday, florists, toy stores, music stores, bookstores, clothing, and sporting goods stores in the city of Los Angeles may offer curbside pickup. Only curbside pickup, not going into those stores at this point. Car dealerships as well, and this is guidance for businesses. Remember how I said that what the state permitted was not something that they prescribed. In other words, the state has told us certain things could open by this Friday. Similarly, the county has said they can open, but it is not an obligation of any business to open. Do what you need to do to make sure you are safe, that you feel secure, and that your people are protected, as well as your customers. And I know our small business owners care the most about their employees and their customers of all of us, and that you will be doing that with us together. And I would encourage all businesses to only open safely. So while you can open as early as this Friday, you don't have to yet until you feel right. Starting Saturday as well, you'll be able to return to trails in the city of Los Angeles. Trailhead parks and our golf courses will be reopened. Runyon Canyon will remain closed. And we are adding a new requirement that face coverings will be required at all city trails and golf courses. I know some people think I'll never see a person, but you can round a corner and suddenly be face to face with someone. We want to make sure that as people exercise in those parks and those trails, that people are still as safe as possible and not spreading this coronavirus. So this doesn't change any of our other rules. If you're 65 and older, you cannot go out to those places. If you have pre-existing conditions, you cannot go out to those places. This is not an excuse for gatherings. Gatherings are still prohibited. We prefer you go by yourself or maybe one other person from your household, but nobody more than a household that is cohabitating together can go out together on these trails. But we know what a difference it will make. We know that we've all been dying, not just to walk around the block one more time, but to see some of the natural beauty of this city, to be able to get out there and do it in a responsible and healthy way. You have to maintain your physical distance, you have to wear a face covering, and we're working around the clock to make sure that these are safe requirements. And there's only so much work that we can do, so we need your help. And I know that as you have done, you will rise to the occasion. This is not some sort of green light to slack off. And remember at the beginning of this, when we issued our safer at home orders, we initially had these spaces open, but we had to shut them down because people weren't practicing those safer requirements. I think we all know them now much better, and we know the consequences of not following them better. So I have a lot of trust that we will be able to, and a lot of hope that we'll continue to keep these open. We are moving this slowly and this deliberately because hasty action, as I said at the beginning of this, kills people. People who you know and people you love, and potentially even you. That's why we've developed a 3-level risk analysis that is being used by the cities of LA County together with the county and neighboring cities to ensure that our data drives decisions, not political pressure. We owe you nothing less. Those 3 things first are looking at key indicators like our death rate, our hospital surge capacity, and hospital admissions. If the data shows us that we're taking too many steps backward, we're going to have to stop and even retreat. These indicators in that case will be shown as red. If the metrics are trending in the wrong direction and tell us we need to pare back our activity to prevent a larger outbreak, so maybe hold where we are, these indicators will be orange. And if we're doing things right and the numbers show steady progress, then the indicators will show up yellow. I know some of you are looking forward to probably green, but we will only hit green when the crisis is over, when we have a vaccine, and when we can truly return to getting rid of all of these requirements. And don't look for that in the foreseeable future. It will take time. Second, we'll continue to have a phased return to a new, safer reality. This will come in phases, and within those phases, there will be steps. We're exiting phase 1, focused on crisis management and saving lives. So on Friday, March 8th, it will mark the beginning of phase 2, with a slow and a gradual loosening of some of the restrictions while always ensuring there's adequate safety measures that are in place. And this won't be a linear process, which brings me to the third of these measures that we are using with the county together, steps to a safer LA. So sometimes you have to be prepared that we will move forward, sometimes we will hold, and sometimes we will have to step backwards, depending on what this virus does, the season, the outbreak, the numbers that we see. So there will be times we step back and that businesses that might be allowed to open now might find themselves closed again, or access to public spaces will again be tightened up or restricted. You'll be able to track the status of these indicators as quickly as we do. That's been my promise to you from the beginning, is to make this confusing period a little less confusing. And we hope that those colors will help you know exactly where we are. We'll describe the phases, the steps that we're in, and you'll see that at coronavirus.lacity.org/saferLA. You can continue to depend on us, and you will continue to hear regularly from me. But to paraphrase Winston Churchill, this is not the beginning of the end, but it is perhaps the end, finally, of the beginning. With that, let me get to the data that you need to know. Today, the county reported 851 new confirmed positive COVID-19 cases in the county, bringing our total to 28,644 diagnosed cases. This is a 3% increase since yesterday, and the average of the last 7 days has seen each day about 904 new cases, still adding cases each day. In the city, there were 400 new cases, bringing our total to 13,868 cases in the city of Los Angeles, also a 3% increase. And today we learned of 55 new deaths countywide. This brings our total to 1,367 fellow Angelenos who have been claimed by this disease. This is a 4% increase since yesterday, and our average over the last 7 days has been 45 deaths each day. Our heart mourns with those who today are mourning their loved ones. Across the county, our hospital capacity remains strong. In our general emergency hospitals, 1,147 beds are currently available, including 944 acute care beds, of which there's 203 ICU beds, and 1,142 available ventilators. We continue to ramp up testing across the county of Los Angeles, the city of Los Angeles, the city of Long Beach, and so many other providers now make it convenient, easy, and remember, free to get a test. We help get ahead of future outbreaks when we do the testing. We help connect people with treatment so they can isolate, and it helps the county public health trace who those folks have been in contact with, to quarantine them and further bend the curve. Anyone can now get a testing appointment. Sick or not, you can get tested to find out if you have COVID-19. And on this point, I want to address a rumor that's been circulating as well here in LA about people who test positive. This information will never be used to harm you or your family. The County Department of Children and Family Services will not take children away from parents who have tested positive. Supervisor Barger mentioned this, but we have heard this echoed a number of times, and I want you to hear it from me. That rumor is absolutely false. Testing is critical to our efforts to stop the spread of COVID-19. So no matter your immigration status as well, don't be scared about getting a test. That information is not shared with anybody. So sign up now at coronavirus.lacity.org/testing or call us at 1-213-978-1028 or just call 311 after 5 p.m. We now have 36 testing locations. 2 of them opened up today to great success. We had a lot of people in both Northridge and Baldwin Hills shopping centers. And today we have the capacity to test 20,400 people. By the end of today, we will have tested through these centers 225,000 people. Testing and basic hygiene, like continuing to wash our hands, are our tools to save lives. So we will continue to wear protective face coverings. We recommend that Angelenos wear those face coverings outside their homes, and we require them, remember, at any visits to essential businesses. And now, starting on Monday, we are requiring all riders on the City of LA's LADOT transit buses to wear face coverings. These are Dash, Commuter Express, and City Ride buses. Our Dash routes provide an important service to so many Angelenos and essential workers like nurses and caregivers who are going to work and who are a lifeline to Angelenos who rely on transit to get their essential goods. It is very important that everybody take this step and cover their faces on buses so that other riders and bus operators can stay healthy. This measure is in addition to intensive daily cleanings, backdoor boarding, and free rides on all Dash routes, as well as reducing the maximum occupancy allowed on buses to ensure physical distancing. It's another step in how we intend to keep our essential workers who are protecting us protected as well. And I support Supervisor Janice Hahn's request that Metro adopt this for Metro riders as well at our next meeting. And thank you for your leadership on that. And I want to thank again all of our transit staff who are doing such heroic work. We've seen tragic stories of transit operators, the bus drivers and rail operators who've become sick, and even some in other cities who have lost their life doing the most basic thing to make sure we as a city can continue to function. And additionally, I'm announcing tonight that starting Monday, all travelers at LAX will be required to also wear face coverings. The new requirement aligns with what many airlines are doing as well. Right now, many airlines require that passengers and flight crews wear face coverings on flights. And these are steps that will help us all be safer. We all know that this crisis has asked so much of us. It's asked us to sacrifice. It's caused us to suffer, whether that's in economic terms or psychological terms. We've had to go above and beyond our usual routines and upend nearly every facet of our lives. But that's not the case for the Angelenos on the front lines of our healthcare systems. They've had to go even further. Our nurses, our doctors, our medical technicians, the folks who are receptionists at hospitals, those who clean our hospitals, and lab techs, everybody have demonstrated the true face of courage and grace and determination in this crisis. They continue to do what they do best, what they've trained for years to do, but in overdrive and now under a new microscope in the most dangerous of times. They care for the sick, they treat our injuries and our illness, and they prepare for the unexpected. They reassure those who are afraid and uncertain about what this virus means, and they save lives. Today is National Nurses Day, part of a National Nurse Appreciation Week that begins today and ends on May 12th, the birth date of Florence Nightingale. This morning, I had the chance to deliver that same message I just shared with you, with nurses at Children's Hospital. And I can tell you, in the stops that I've made at the hospitals at 8 o'clock at night, where I've gathered outside the emergency room with folks that are tired, but committed and loving of all of us, I want you to know how much it means to them that we say thank you to our nurses and all of their colleagues. I've gone by Kaiser at Sunset and Cedars-Sinai, White Memorial, and I'll be continuing to hit more hospitals as many nights as I can. Those of you can see or have seen through our media, City Hall lit up blue in some of our main buildings. It's every night that we say thank you. And we know that you, nurses, don't ask for accolades. You don't ask for recognition or praise. We know that you believe in this long before this crisis. It's who you are. But your work is a source of healing and hope. And we can never do enough for our nurses and our colleagues. We all know a nurse. I want to thank Natasha for what she is doing, a member of our family who works at Cedars-Sinai. I want to thank each one of you who makes sure that we are not only healthy, but hopeful as well on this, your day and your week. As we enter a new phase of this response, we can each do our part. Make sure, as I said, with these new freedoms that we will have, these baby steps forward, that we take on new responsibility. Make sure that it works. Let's show the success collectively of what happens when we begin to open the door just a crack and to let a little bit of light in. I promised you at the beginning of this that, and it was raining at the time, if you remember just a few weeks ago, there were storm clouds all around us, but I saw rays of light breaking through those clouds. Today and this weekend will be the beginning of that, a time for Mother's Day where we can send flowers to our mothers, a moment where we can go out with somebody in our household maybe and take a walk in a park in Los Angeles. But let's make sure we use our judgment. Let's make sure we adhere to the regulations and to the orders that are still before us. And let us earn each step moving forward with the hope and the idea that there will be a safer, a more prosperous, and a better future ahead for all of us. So as I always say, stay healthy, stay safe, and stay at home. Much love and much strength, Los Angeles. Let's keep moving forward. With that, I'm happy to answer questions tonight. Thank you. I'll take the first question.
And let us earn each step moving forward.
And the first question comes from the line of...
Sorry, I couldn't quite hear, but go ahead. First question?
First question comes from the line of Leslie Marin. Please go ahead.
Hey, Leslie, how are you doing? Go ahead. All right, we might have lost Leslie. Let's go to the next question if she's not on.
Next question comes from the line of Steve Gregory from KFI News. Please go ahead.
Hi, Steve.
Hey, Mayor, good evening.
Good evening.
I'm sorry, I joined a little late. Did you address beaches and your plan for beaches? Also, I'm wanting to know if any of your orders are going to be modified to reopen rec centers like the Barrington Recreation Center and things like that, and the tennis clubs and things like that around the city as well. Thank you, sir.
No, beaches remain closed, rec centers remain closed, and any of those group sports that would be in a rec center remain closed for now. So all three of those are not permitted. These are the first steps. It's with trails, trailheads, golf courses, full stop for now.
Are you pretty much following the 5-stage program that the county laid out earlier today, or are you going to sort of customize it for the city?
No, as I said yesterday, this virus thrives off of division. Wherever we get good guidance from the state and the county, we will always try to align as close as possible, if not exactly, with them. And I do find that governor's phases helpful. The county built on those, and we will absolutely be using that. There will be times, and I want to be clear though, where I will have to make judgments for the city of Los Angeles and my power as mayor to sometimes go slower. But I feel confident that the same sort of drop-off that we have on the curb or pick-up on the curb that we have for restaurants is a safe enough activity for us to do with retailers moving forward. And that I do believe that we can make our parks and trails safe enough in our golf courses, especially now with face coverings, the physical distancing requirements, and a reminder, this doesn't allow you to go for a jog with 20 friends. This is about staying still with that pod of your household, staying still if you are a vulnerable population because of age or because of pre-existing conditions. So we are absolutely in alignment. I talk all the time with our mayors like Mayor Garcia in Long Beach and Mayor Tornick in Pasadena was on the phone earlier this morning with a lot of mayors before we heard the new county guidance. And we're constantly trying to make sure we march together. So we are in alignment with the county, hope to continue to always be, and we have those conversations long before to make sure we are. Thanks. Next item, please. No, next question, please.
We have a question from the line of Leslie Marin with CBS CCAL. Please
There
go
we are.
ahead.
Hey, Leslie, how you doing?
Hi, Mayor. Hopefully you can hear me this time.
Yes.
Just want to see, how does the city plan to monitor, regulate that businesses that are said to open on Friday and then Saturday are following these guidelines?
Great question, and thank you for asking it. Luckily, we're not starting from scratch, Leslie. We've been doing this with the order before we modify it. We've been doing this with the business ambassadors. I've said it's the 3 E's: educate, encourage, and enforce, in that order. Educate people, let them know about the rules, because 99% of people and businesses adhere to them. Second, though, if you find folks that aren't, encourage them to comply. Sometimes that takes 2 or 3 visits, but we usually get 95% of those, 1%, complying with it. And then for the small minority that after education and encouragement don't adhere, we have enforcement. And as we've announced many times here, we've had to refer those through LAPD to our city attorney and to court. So we absolutely have that full spectrum of things, but really I want to encourage people to do it right. And a third thing I'll say is, on the education side, we're going to be putting out guidance to help. How does a retailer do this? I don't expect every mom and pop retailer to know exactly how to do that. So I know the county's looking at putting that out. You can't read too many of these things. The state may put them out. But for businesses inside the city of Los Angeles, we're going to put those suggestions about how you can keep your people safe, what is prohibited and what is permitted. So it's crystal clear in kind of plain English. So we hope to have that up tomorrow, if it isn't already up tonight. We might be there at the Safer LA, coronavirus.lacity.org/saferLA, to help those retailers, for instance, that are a bookstore or music store or clothing store know how to do this and how to do this right. And one last thing I'd encourage folks, don't open early just because you can. Get it right, build the system, make sure you have your employees safe, your customers safe, and then open. It just gives you permission from Friday on, but we know most people will be taking more days and some other weeks to get it right. Thanks, Leslie. Next question, please.
Next question from the line of Claudia Pascude. Please go ahead.
Hey, Claudia.
Hi, I have a couple of questions.
Sure.
So, some people are getting really big DWP bills right now because they're obviously spending a lot more time at home than they normally would, which is kicking them up into higher tiers. And I know that utilities are not supposed to be shut off during the crisis, but I'm wondering if there's any thought being given to, help alleviate those rising costs for customers. And then on the testing side, I did get a question about setting up more walk-up sites for people who don't have cars. And I continue to hear issues about testing at the drive-through site, confusion with directions, samples being collected in a way that raises concerns about about whether they're being damaged and the test results will be affected. And people continue to tell me, and obviously I've heard from only a small sample of people, but telling me that they're not getting the results and we're near 30 hours, taking several days. Thank you.
Sure, let me work backwards. And I know you even put up on your Facebook page and got some really positive response about how quick the turnaround is. The average remains 30 hours. That's an average, so there will be some, and you will probably, for every other night that I'm able to make these presentations, be able to find somebody that's taking longer. Let us know when you hear those, because we love, or anybody listening who hasn't been in contact with the media, call us during the day. 311, we usually specialize in a few dozen of those cases a day of the thousands that we do to make sure people get their test results. Sometimes it's changed phone numbers, sometimes there was a mess up with how it was transcribed, but we have a very good rate. It's one of the fastest turnarounds in the country. We're very proud of those metrics, and we always want to do better. I also have questions for you, Claudia, because I know you asked again at the county press conference, and so I looked into it in detail. The vials that we use are incredibly strong. In fact, after you put the swab in them, you shake them up. So we're not worried about them being damaged when they're dumped in. Secondly, in terms of the heat, we checked with the lab. 41 degrees Celsius is the limit of the heat, and they still feel very confident it's nowhere close. That's about 110 degrees out, and they're picked up twice a day. So we're very confident that, I know you said somebody told you about them being dumped there, and they were worried they were in the hot air for too long and maybe damaging the test results, but we did follow up, and thank you for asking the question, and we have that there too. In terms of the DWP bills, absolutely. We've been looking at what we can use our coronavirus relief funds for. First, we have to pay back the costs for testing, for the personnel, for the money we borrowed from the reserve fund, for the PPE, the masks and other equipment for our firefighters and police officers, et cetera. But with remaining dollars, as I've said, we want to look at what we can do to help with housing and homelessness and help for everyday Angelenos. Whether you do that off of a bill or whether you give that, in the form of food assistance, rental assistance, utility assistance. We've asked DWP. We're asking the Treasury Department to let us know what we can and can't do. So we absolutely want to continue giving financial relief. We know that if you can take some dollars off of a family's budget for food, that helps them pay the utilities. If you can help take it off the utilities, that might help them pay the rent. If you can help them with the rent, they might be able to pay off both their power, water, and get their food. So absolutely that's on the table. Nothing to announce yet, but it's something we've been looking at very aggressively and looking at what we could do potentially with the coronavirus relief funds that we've gotten. Lastly, in terms of the tiers, you bring up a good point, and it's a suggestion in some ways to me to look at if families who aren't, a huge mansion that has a ton of lawns using more water just because there's 4 or 5 people and it kicks up to a new tier, maybe that's a place where we can help. So you've planted the seed. Hopefully in coming weeks we'll come up with some programs. We'll absolutely be sharing those with you as soon as we have them. Thanks, Claudia, and thanks for the questions. Next question, please. Next question.
A question from the line of Alex Michelson. Please go ahead.
Hey, Alex. Did you order your flowers yet for Mom? Alex, are you there? I don't know if you're muted. Testing, testing. Alex?
First of all, thank you for the nomination. So many viewers emailed me about the UPC mission in Riverside. Temple now running one of the largest food relief operations in the Inland Empire.
I think we are hearing a little bit of the broadcast, but Alex, he might be actually speaking right now. So we'll come back. Alex, call us if you have your question. Let's go to the next question after that.
Next question comes from the line of Louisa Marshall. Please go ahead.
Hi, how are you?
Hi, Mayor. I know that you just announced that florists will be able to open Friday for curbside pickup, but we've witnessed them open in downtown LA for weeks, already allowing customers to come inside their shops and not practicing social distancing. You've mentioned the city will be monitoring the shops, but can you tell us exactly who will be monitoring them and how they'll go about doing that?
Sure. Look, we've had to do this not just with florists, but with smoke shops and all sorts of things since the beginning. I've announced here, people should call, let us know, 311, folks who've seen businesses that are operating when they shouldn't be. And for those, because I know the downtown some of the florists downtown have been in the news in the last day, we've made 65 visits with our business ambassadors to any stores that we heard that were open. 95% of them complied with the first, second, or third visit. And it does sometimes take time. Remember, it's educate, encourage, and sometimes it's 2 or 3 times of encouragement. And we've had to refer 3 complaints by LAPD for action. Some of them did move then from inside their shops onto the street to sell on the streets, and street inspectors have gone out there for those. Obviously, moving forward, it won't be as much of an issue. If folks do go into stores, though, now, because it's only curbside, we will continue to take those calls, to have visits, to encourage, to have the business ambassadors, to have LAPD, and potentially action by city attorney. So that isn't unique to florists. There hasn't been 100% adherence. There are tens of thousands of businesses in Los Angeles. So we will continue to go out there. You should adhere to what the orders do, and I hope now that there's curbside delivery and pickup, that is something that will go a long way in helping these florists. Those that might have thought that they could break the law, go against the order, now will have some of that oxygen released, get some business back. And I know this is a big, big weekend for them. Mother's Day is, if not the biggest, one of the biggest days for florists. So we'll continue enforcing not just with them, but with everybody. But we always start with education and encouragement first. Thanks for the question. Next question, please. Next question.
Next question comes from the line of Stephanie Stanton. Please go ahead.
Hi, Stephanie.
Hi, Mayor. You've been pretty clear that you didn't feel that LA City was ready to step into phase 2. I believe it was even up till yesterday. Can you tell us what it was that sort of turned you around to allow the city to fall in line with the county for this Friday in terms of the reopenings? And did that involve any political pressure?
So thank you for the question, Stephanie. I mean, I still do believe that much of what's described in stage 2, we are not ready for. But there are things that I believe we are. And whether it was done next Friday or this Friday, to me, wasn't much of a difference. I do believe that curbside retail, which is very low risk and which we've been exercising with food for a long time, can be done the right way. I was confident about that when it was announced. Car dealerships I've not had an issue with too, as long as folks aren't, in the showroom and they're doing it appropriately as the county prescribed. And recreation is one that we looked at potentially a week later, but the county decided to move now. I asked my team because I think it would have been very confusing for certain parks in the county to be open and trails and the ones in the city not to be. I didn't want to have our LA City residents rushing into county trails that would perhaps endanger people because they're overcrowded. So the right way is to do these things together. And those two things I was comfortable in this next week moving forward with. So both of those, I believe, are either low risk or things that we can safely do. But as I tried to say at the beginning, these phases or stages have many steps in them. Governor Newsom has talked about that too. And there are things still in phase 2 that absolutely we are not prepared to take those steps forward. And I rely on our public health officials. So if Dr. Ferrer says it's okay, we feel confident and we can move forward, to me, sometimes we'll slow down just to get the logistics of implementing that, because public health professionals say what's permissible, but it's cities who get all the calls, who have to have the police or park rangers or whatever ready. So occasionally we'll take a couple more days, but I was confident, because we've been gearing up for this, that the city of Los Angeles could move together with the county, as they said on Friday. That was something I and the other 88 cities learned of just this morning. It was not political pressure. They made those decisions. You'll have to ask them and the public health professionals why this week rather than next week, but we were prepared to do that. Looking forward, though, as I said, we need to move together. I think that every 2 to 4 weeks, or maybe 3 to 6 weeks, we should be kind of informally talking to each other and saying, what are the next baby steps? So far, so good. We didn't see numbers going up. Our indicators that I mentioned are still strong. Hospital admissions are steady. We have capacity out there. Our positive cases are okay. Our deaths have not started to skyrocket. Then we can look at baby steps. And maybe every month or month and a half we say, is it time to take some bigger steps within either a phase or sometimes into the next one? I know that can be confusing, which is why I think it's going to be important, why the city will put out kind of these colors to let people know, like, how do you make these decisions? How do they make these decisions? Well, we've all agreed on those indicators now between the county, city of LA, and other cities, that it is important to track these things: deaths, hospital capacity, how much PPE is available, what is the tracing capacity that the county has to quickly find people who have been in contact with positive COVID-19 patients. And as long as we have those that are measuring and we can see what the status is, it will inform those decisions. When it's in red, we're not moving forward at all. And even hypothetically, and I don't believe Dr. Frere would ever recommend when it's read moving forward, but if the county did put out something saying, this is what's permissible, I will not be shy about in the city of Los Angeles saying, we're not ready to do that yet. But these are appropriate little baby steps that we have the capacity to protect. It will never be just government, though. Final message is kind of where I started. It's also on all of us to adhere to this. So that's why we're putting a little bit additional in there that I'm sure other cities will do as well as they implement the county's orders to wear facial protection while you're outside in the trails and parks, while you're golfing, things like that, because that ensures us that we can keep these victories, maintain them, and not retreat. Does that answer your question?
Thank you.
Okay, thank you. Appreciate it. All right, I'm told there are no more questions. I guess we didn't get Alex back. Alex, you can ask me 2 questions tomorrow. I want to thank everybody again. I'm going to give some remarks in Spanish as well. Again, please go to coronavirus.lacity.org and check out those guidance pieces for businesses. Those are up now. So they already are up. I want to just ensure that those are up today. If you go to those, you can check it out. That's coronavirus.lacity.org/saferla. If you're a business that now is permitted to open, check it out, see if you can adhere to it. Take your time if you need to, do it right. And to the people of LA who are going out there this weekend to some of our trails and some of our recreational opportunities, adhere to the guidance, be safe, and remember, it changes nothing else in the order. Thank you all, and I'll see you tomorrow, and now in Spanish. Buenas tardes, Los Ángeles, y gracias por venir otra vez al ayuntamiento. Hoy la doctora Ferrer anunció que ciertos negocios minoristas, anteriormente clasificados como no esenciales, podrán abrir para ofrecer compras para llevar y ciertos espacios públicos como senderos para caminar podrán abrir de nuevo. Esto significa que la vida no va a regresar a ser como lo era antes. Este virus sigue siendo tan peligroso hoy como lo era el día que apareció. Entonces, no nos olvidamos del COVID-19, simplemente aprendemos cómo vivir con él. Y lo hacemos con tomar pequeños pasos adelante para protegernos. Mañana haremos modificaciones a la orden protegidos en casa. Empezando el viernes, floristerías, jugueterías, tiendas de música, librerías y tiendas de ropa y deportes podrán ofrecer compras para llevar y concesionarios de autos podrán abrir. Y empezando el sábado, podrán regresar a senderos para caminar y canchas de golf. Sin embargo, es necesario que mantengan la sana distancia y que sigan llevando coberturas faciales, lavándose las manos y la higiene adecuada. Estas medidas siguen siendo más importantes que nunca. Tomando acciones apresuradas podrá matar a gente. Por eso diseñamos 3 niveles de riesgo para guiarnos. Primero, miraremos nuestra tasa de muerte y capacidad de hospitales en Los Ángeles. Si los datos indican que estamos retrocediendo y todos tenemos que quedarnos en casa, estos indicadores estarán de color rojo. Si muestran que estamos moviendo en la dirección equivocada y que tenemos que frenar actividades para prevenir otro brote, estarán de color naranja. Y si estamos progresando y moviendo en la dirección correcta, estarán de color amarillo. Solo logramos el nivel del color verde cuando se acaba esta crisis. Segundo, estaremos regresando de manera gradual a una nueva realidad que es más segura. Estamos saliendo de la primera fase y el 8 de mayo será el comienzo de la segunda fase, cuando soltamos poco a poco ciertas restricciones. Y hay muchos pasos en cada fase. Y tercero, estos son pasos que estamos tomando para protegernos, para salvar las vidas. De vez en cuando avanzaremos, otras veces nos detendremos y de vez en cuando tomaremos pasos hacia atrás y posiblemente tendremos que cerrar empresas de nuevo. La responsabilidad está en sus manos. La responsabilidad es el resultado de estas nuevas libertades. Para seguir estos datos, especialmente si tú eres un dueño de una de estas tiendas, visita la página coronavirus.lacity.org/saferla. Ahora les comparto los datos de hoy. Hoy hubieron 851 nuevos casos en el condado de Los Ángeles, llegando a un total de 24,644. En la ciudad tuvimos 400 nuevos casos, llegando a un total de 13,468. Y hoy supimos de fallecimiento de 55 personas más en el condado, llegando a un total de 1,367 muertes. Lo siento mucho por las familias que están sufriendo como el resultado de estos fallecieron. En nuestros hospitales tenemos 1,147 camas disponibles y entre ellas 203 están en las unidades de cuidado intensivos y tenemos 1,142 respiradores disponibles. Hemos ampliado el acceso a pruebas para todos, si tienen síntomas o no. Y quisiera corregir información falsa que dice que personas con resultados positivos están en riesgo de que el Departamento de Niños y Familias se lleve sus niños. Esto es completamente falso. Nadie usará sus resultados médicos para hacerle daño a su familia. Y no es importante su estatus migratorio. Toda la gente, todos los residentes de Los Ángeles pueden tomar una prueba y merecen una prueba. Todos pueden hacer una cita para hacerse una prueba, aunque estén enfermos o no. Visita la página coronavirus.lacity.org/testing o llámanos al 213-978-1028 o al 311 después de las 5 de la tarde. Hoy tenemos 36 sitios de pruebas y la capacidad de hacer pruebas a 20,400 personas al día. Y para el final de hoy, habremos hecho pruebas a 225,000 personas en estos sitios. Además, empezando el lunes, todos los pasajeros de los buses LADOT, el Departamento de Transporte por la Ciudad de Los Ángeles, estos son, por ejemplo, Dash, los buses de Dash, de Commuter Express. Todos los pasajeros serán obligados a llevar coberturas faciales para proteger a nuestros residentes y a nuestros empleados. Además, empezando el lunes, todas personas en LAX, en nuestro aeropuerto, incluyendo todos pasajeros, serán obligados a llevar coberturas faciales. Y en nuestros parques este fin de semana es una obligación también llevar coberturas faciales. Finalmente, hoy es el Día Nacional de Enfermeras. Yo fui al hospital de los niños aquí en Los Ángeles esta mañana y es nuestra oportunidad para reconocer cuánto las agradecemos por su trabajo en salvar vidas y cuidarnos en estos tiempos difíciles. Nunca podemos hacer suficiente para ellos y para ellas, pero podemos ayudarles con estas mismas acciones. Hermanos y hermanas, quédense en buena salud, quédense protegidos y quédense en casa. Tenemos más pasos en estos próximos días, pero hay una luz y estamos marchando a esta luz, poco a poco, paso a paso, y estos días mejores son en los días de esta próxima semana. Fuerza y amor, Los Ángeles, y hasta mañana. Gracias. Thanks, everybody.